So let's get started with our speaker. Today we are thrilled to once again be partnering with the Society for Human Resource Management, or SHRM. Those of you who have come to our HR seminar in the past know how much we value our connection to SHRM and the expertise that they've shared over the years, and today will be no exception. I'm going to turn it over to Selena for a speaker introduction.
Hello. Okay. Sean Sullivan is the Chief Human Resources Officer at the Society for Human Resource Management. Sean serves as the Chief Human Resources Officer and is responsible for providing human resources leadership, vision, and service delivery for SHRM, the world's largest HR professional society. Sean has over 25 years of experience in human resources strategy and operations. He has built his career across multiple industries, including healthcare, defense, technology, IT, manufacturing, applying his expertise to help grow and support diverse business models. I will turn it over to Sean.
Excellent. Thank you very much, Selena. So it's a pleasure to be here and truly an honor to be working with you this afternoon, and appreciate all that you do on behalf of the various states that you represent, and the service that you and your teams provide for each of those state legislatures. I realize this is a very unique time, so wanted to be able to talk to you about some key takeaways for you today. There are some things that I can share with you in terms of what our experience has been at SHRM, because we returned to the workplace at the beginning of June, and we did that in a phased approach. So I have some lessons learned. A number of you are already back in the office, or you're working in a hybrid way. And so there may be stories that we can commiserate on as well. But I wanted to share with you some of our lessons learned, as well as some research that we've done in terms of what the broader landscape is for the return to office efforts, and where different organizations are at. And Natalie, if we can go to the next slide, we'll jump into it. So we know that for HR professionals, this has been a really challenging time, but also a very gratifying time in terms of being able to step in and take on a role in terms of the overall operation and planning for organizations, that in many cases, there's been a vacuum there in terms of how organizations respond to this very unique point in time, because this is the intersection of people and their workplace and workplace policies. And I think no one has been better prepared to be able to step into that than HR professionals. So you see where 68% of HR professionals report that their leaders have relied on them significantly since the pandemic began. And 4 in 5 HR professionals also report that their work has been especially crucial during this period of time. It's not only been in the communications, but it's also been in the strategy and policy formulation. And if we go to the next slide, Natalie. So 45% of organizations have not announced a return to work site date. This was taken a little bit earlier, so towards the beginning of July. Some have progressed beyond that. But this number does represent the significant flux that businesses and public institutions are in terms of dealing with the unknown and trying to map out future state, both for their customers, their constituents, and their employees as well. For those organizations that have identified a return date, there's a whole range of strategies for returning to the workplace. And we see that reflected even in what you provided within the poll today. So I think that's fairly consistent. 39% will implement a phased strategy similar to what we did here at SHRM. And so you have everything from that all the way to allowing employees in 10% of organizations, allowing employees to select what will work best for them. And we realize that most organizations are somewhere in between. So Natalie, if we go to the next slide, um, wanted to talk about some of the health and safety measures as people come back into the workplace or are preparing to come back into the workplace. Some of the things that organizations are contemplating and putting into place. Um, we've seen a whole range of interest in terms of what our organization's doing. We have our knowledge center here at SHRM, and that is kind of our frontline advisory to all of our members and to different constituent businesses. Those knowledge centers where we typically have maybe 10,000 calls in a day, that surged to almost 50,000 calls in a day in terms of the need for information. That's been remarkable and just underscores that people are looking for information and resources wherever they can find it. And we're delighted to be able to share our information with our members and other folks. 86% of organizations are requiring the use of personal protective equipment, the PPE, in the workplace. And many of those organizations are paying for it. A lot of this reflects frontline organizations, whether it's in healthcare or certain aspects of food preparation, where there is some expectation that these kinds of things are provided for. I think as we see more office workers come back into the workplace, the number of or the amount of organizations investing in PPE may drop off when you start getting to just the more singular focus on the mask. Here at SHRM, we do provide masks for people who forget them, but frankly, we have found that most people are coming in the door with masks that they're comfortable with, as opposed to using a standard issue kind of mask. And as long as it is covering nose and mouth and is securely on, then we have no issue with people attending to their personal needs in this regard.
Sean, before we move to the next slide, could you just delineate for us what each bar stands for? It's just a little hard to see, I just noticed, so I thought it might be good. It's really good information. I want to make sure everyone can.
Yeah, so I'm sorry, the top bar, and we'll just work our way down. The top bar is requesting employees to self-report symptoms or exposure to travel. So that's 97% of organizations are including that. A lot of that comes in the form of the, for instance, the CDC symptom daily checker that employees can utilize. The second one at 91% is posting signs at entrances to ask the potentially exposed not to enter. So just a lot of focus on signage and helping people understand what the requirements are of entering any place of business. And then 86% are, that's the third bar down, are requiring the use of PPE. And then the last one is 73% are requiring on-site medical screening or temperature screening. At SHRM, we've chosen not to do the temperature screening because we felt that issues that would cause because of how people come into our workplace, we would be creating queues or lines in areas where it would be hard to honor the social distancing. And we really were not comfortable with having a staff member having to be responsible for the actual scanning. Different organizations arrive at very different places in terms of how they approach this. You may be in a situation for some of you where the public access to the buildings in which your staff are working, if that public access is still generally on, there may be a very compelling need because you can't quite control who's coming in. It may very well make sense to do the temperature scan so you have some method of control, some kind of protection there. And if you're doing that for the general public, then you would, it would make sense to extend it for your employees. So I fully appreciate people will come at this from very different places. Thank you, Natalie. If we go to the next one, this is just to highlight that there are a number of changes in the workplace. You see it in terms of how organizations are addressing the number of people on site. Some of that, for instance, 75% are staggering start and stop times. For us at SHRM, this wasn't really significant because we already have a pretty graduated start and stop time. It's not like everyone has to be here at 9 o'clock in the morning to start the day. So we have many people who arrive earlier, some who arrive later. So we didn't feel we needed to go to that stagger stop. 78% are reducing the number of on-site customers. This, I'm sure you're probably seeing reflected in some of the buildings that your people are in, either if they're co-resident with other agencies or just trying to see their representatives. You're going to have some way of being able to spread out and manage lines, recognizing that the old notion of the seating area, the waiting area probably doesn't work well anymore. So many places have eliminated those altogether. So if you're not able to sit, what makes sense in terms of configuring those spaces? This is where the partnership with your facility services, I'm sure many of you have already recognized, working with your administrative teams and your facilities teams and security is absolutely critical. So you're jointly looking at these things and bringing those multiple perspectives to how to manage areas where in the past you probably didn't give much thought to. 89% of organizations have or are considering employees to wash hands or use hand sanitizer when they're entering work locations. One thing I would caution you is whatever you mandate, you have to be prepared to enforce. And so you have to have a sense of what your workplace culture is, how compliant it may be, or not, and just decide where do you have the time and energy to spend on some of these things. So while some of them would seem to make sense to mandate, I would just encourage you to say, can you get 95% of the way there if you say we are requiring or we're strongly recommending versus mandating? Because once you mandate, you've got to police that, whatever that thing may be. So I just caution you on how you present and roll out some of these different workplace requirements. A lot of organizations are looking at, are there things that we can do to eliminate the contacts with, whether it's door handles, elevator buttons, can you go to verbal commands on certain things? Do you have, touchless wash stations within your restrooms? In some cases, I'm guessing that some of your infrastructure is somewhat, could be somewhat dated if you're in more historical buildings or in public buildings that have been in place for a while. And you may not have that luxury of being able to cut over to those kinds of technologies. One of the things that we had to consider here, we had a number of thoughts of, oh, we'll leave, X number of doors open so you minimize the number of places where people actually have to touch a door. Well, that also kind of comes into conflict with fire safety regulations, and many local ordinances will prevent you from propping open doors because you're entering into fire hazard kinds of issues. So sometimes we might think what an obvious solution could be, and you just have to make sure it's in sync with other kinds of requirements that are already in your workplace. Natalie, if we could go to the next slide. So 68% of organizations are reporting that they will adopt or will most likely adopt broader or more flexible work from home policies. This has worked especially well for large organizations and large organizations that tend to be in the professional or professional services spaces, large consultancies, knowledge industry organizations. Um, we all know there's many businesses that can't afford to do that. You all are in constituency facing kinds of businesses and fully recognize that while there may be times where you can have a hybrid approach or have people work from home, at the end of the day, there's a need for access to your organization. So the need for you to be prepared to have people on site, fully appreciate is absolutely paramount. And if we go to the next slide, that's some of the landscape of what we have found, and all of that has been through SHRM research. We've got that available, happy to make it available to people. In that context, what we have found, both for what we've done and as we've talked to different businesses, is that the clear communication between management and employees is absolutely paramount. So whatever you're doing in policy, whatever you're doing in workplace safety, however you're bringing people back into the workplace, whatever the need to have a very well thought out communications plan and be able to execute to it is absolutely critical to being able to do this effectively. And we have found that it means repeating messages. Even when you think you keep repeating the same information, people get it in different ways. We use Slack, we use email, we use company broadcasts or webcasts. And we have found repeating the same message through each of those channels is absolutely necessary for people really absorbing what we're trying to do. And even when we thought we communicated enough, we always get feedback that more is better. And I'm sure that's a lesson many of you have learned over and over. So if we go on from there, just a couple of items in terms of advanced planning and considering high-risk populations. So you've got 3 pie charts here that just highlight what percentage of organizations are trying to account for additional safety measures for high-risk employees. 76% reported that they have implemented some kind of measures for high-risk employees. 69% are also extending or thinking of adding additional safety measures to employees living with a higher risk individual. And 60%, that last pie chart, are taking into account employees living with a frontline worker, such as healthcare, first responder, and what that means for increased possibility of exposure. And then among organizations implementing phased return to work strategies, the phasing has been based on department functions that are most common. So you try to see many organizations have really endeavored to bring back people with the lowest health risk first. And 26% have started by bringing leadership back into the office first. We took the approach of really trying to understand where our employees were at based on discussions with managers. And in that process, employees, one of the categories that was significant for us was employees who had dependent care issues and needing additional time for them to be able to resolve some of those issues for their own situations, because the typical option A, option B of where you might be able to take your kids, as we know, many of those options just weren't available. Schools were closed. Summer camps were not opening. If they were opening, it was for a very limited number of people at a time. And so each of those options requires, I think, some working with employees and meeting them in terms of where they're at. Natalie, if we go to the next slide. And again, just a couple of things with respect to the social distancing. This is really important. People will measure, are they 6 feet away from a colleague? And, here you see some indication of what organizations are doing. Most of them are reducing available seating. Most are setting limits on the number of employees in common areas. Steps that we took were limiting conference rooms and not allowing more than what could safely social distance in that conference room. And for many of our conference rooms, that meant having 2 or 3 people in a conference room, not more than that. And in many cases, we also, overall, SHRM has not allowed visitors into our workspace. We're trying to make the workspace safe and productive for SHRM employees. We've just said if you have outside visitors, you continue working with them in a virtual sense. Because of the public that you work with, fully appreciate that may not be a good option for some of you, depending on what the expectations are for your state legislature. And then if we can go to the next slide, Natalie, I'd really probably on this and the next slide, I'd like to spend just a couple of minutes talking about things that really are prominent for workplaces. That notion of workplace cleanliness is absolutely critical. You need to have visible efforts for cleaning surfaces. That said, it's also clear more and more that CDC and other organizations are assessing and saying while surfaces are important, the most important things are managing the personal interactions of people, staying out of large crowds, using masks, keeping distance, and limiting the amount of time that people are in close contact with one another. And so at a certain point, you will have a part of your population, your workforce, that are going to tell you that there's not enough you're doing for cleanliness. I think you just have to be really clear on what is being done, keep reiterating that, and help people understand what they can do to contribute to a safe workplace. For work modifications, we stopped the notion of hoteling in terms of sharing common workspaces because we couldn't guarantee that we knew a workspace would absolutely be cleaned in the time that might be before one person came in on top of another person departing. So we've tried to eliminate the sharing of workspaces and the sharing of equipment and supplies. We have said on a number of policies and practices, we're putting those into a temporary, many of our practices we're adapting on the fly. And we're trying to be clear about those, but people who point to practices that have been in place, we've just had to say, look, we're in a different time, we're adapting, and we're requesting that you do as well. Natalie, if we go to the next slide, might be, I recognize we're up on time. So I want to be respectful on that and finish probably on these points here, which is you're bringing people in. People are very conscious of of what the environment is. Anything that you can do to highlight the positives, to encourage appropriate celebrations, recognizing the good that's going on. If you celebrate service anniversaries, find a safe way to do that. Other awards, keep those going. They contribute to a positive work culture. Keep on track with performance goals. Help people stay future oriented in terms of the work that they're doing. And really keep working through and modifying your policies and procedures and be clear in communicating those to people. And then finally, on mental health resources, people will come into the workplace, we often have no idea all the things that have happened to them along the way. Family that they're concerned about, friends and loved ones that they, may be worried about. All of that now is heightened in the workplace. Anything that you can do, as this chart highlights, anything that you can do to help people stay in touch with mental health care resources is a tremendous service. If you have employee assistance programs or access to other kinds of services through your benefits, please highlight and communicate those and help people understand how to access those. Family stress is at an all-time high. If we go to the next slide, Natalie, we've got 2 in 5 employees already feeling burned out. They're coming back into a workplace where they may have some anxiety of being there. 1 in 5 employees believes that COVID-19 has threatened some parts of their jobs to a very great extent. 37% of employees haven't done anything to cope with the depression-related symptoms they're experiencing. It just highlights the very sensitive kind of workforce that you're working with. I know you all know that. Anything that you can do to plug people into wellness and mental health care resources is well worth the investment. Finally, if we go to the last slide, Natalie, we have a number of resources available for you through SHRM. Please, we've got COVID information. We have information on the Emergency Family and Medical Leave Act as it may apply to you, and a number of other resources. We encourage you to take advantage of those. I really appreciate the time to walk you through some of this information and some of the story, some of our story of getting our workforce back into the office.
Sean, thank you so much for that and for rolling with the punches on the slide deck. We all learn new Zoom tips and tricks every day, I think. I know I do. Wanted to make sure all the attendees know that we'll be sure to share this slide deck with attendees after our time together is over. And also an important announcement that I failed to make at the beginning, which is that we recorded this session. We had several of your HR colleagues in other states say they wished they could attend today but couldn't. So we will be stopping the recording once we get to the breakout portion of today. But for now, we recorded this session. Thanks again to SHRM for letting us do that. And really want to turn this time over to you and let you ask Sean questions. We encourage you to drop them in the chat if you have them, or just unmute yourself and ask away.
Hey, Sean, it looks like Catherine wrote, can you please say more about support for employees with young children in addition to FFCRA or allowing continued work at home? It's a very difficult situation.
Absolutely. It is a very difficult situation. And the approach that we've taken, and we believe we have the flexibility to do this, is one, to funnel all of those requests through our HR team, our benefits team. Our benefits team is used to working with all of the different leave conditions. And so we try to sort through with employees what the nature of the dependent care issue. In some cases, we're able to point them to alternative dependent care options that they might not have had on their radar screen. We try and problem solve with them. Is this a time-bound thing where they need just 2 or 3 more weeks and then they've got a solution in place? Generally, you can probably work with that. Or is it the case that they really do need some kind of provision under the Emergency Family Medical Leave Act for the care of a dependent child? In which case, can they work part-time? Do they, are they able to find coverage for 20 hours, but they just need to reduce for a period of time to 20 hours? So if you've got the bandwidth to be able to do it, meeting people on an individual basis, trying to understand their circumstances, we think allows for the best solutions to come forward.
Please ask away if you have any questions. I know. While we wait for folks to maybe think about something, Sean, I know we had touched on the issue of contact tracing and the role of HR in that, with respect to that issue. Is there any more you could say about that, or how SHRM approaching that?
Yeah, so we are working with our managers and actually found we needed to adapt some of this, Natalie, in terms of what we thought we could do originally, and then what actually makes sense to be able to do. And all that is to say that within HR, we do, if someone poses as symptomatic, we do try to understand, what the timing was, who they've been in contact with within the workplace. So we go through a whole protocol of asking those questions. We've started to work with managers to give them the same or a subset of those questions, because they can often jumpstart kind of that information gathering. And that just helps us in terms of managing what's happening in the workplace. We did reach out to our local city public health department and said, how do you want us to handle this? If we have a positive case, how should we handle that? So we're in touch with them. We also learned that, wherever the person is resident who maybe either symptomatic or has tested positive, that's where that county will actually kick off the contract tracing. So in HR, we're not trying to do that wholesale. That's beyond our remit. But we are trying to do it within the workplace so we know which employees to advise and how to respond to any situation, whether it affects a whole floor, a whole team, or if it's been a very isolated situation.
Thanks, Sean. I see two more questions in the chat. I think we'll throw those your way, and then follow up with people after, as I know you have other things to move on to. One of them is about, now that telework has been allowed and prevalent, what are your tips on transitioning employees back to a physical work site without minimal pushback?
Yeah. So I think what I would recommend is you really do have to help people understand that logic of, why you're coming back, why now, why is it important to be back in the office? And, frankly, I think the work that you all do lends itself to a very public-oriented mission, right? So I think the ability to serve the public would seem to be a core part of that message. And so I would encourage you to state that, even if it's obvious, being able to state that expectation and talk about why ultimately it's really important to be able to get back to and serve the public in the manner that they're used to being served is really critical to the mission of the organization. Again, it may seem obvious, but I think you have to play that story through and just make it a consistent part of your narrative. And then I think that can help people go, right, that's that's what we do, that's how we work. The telework has always been considered a temporary arrangement for most of your workforce, and I would just reiterate that. And that because you've learned enough about the virus and you're paying attention to what the CDC and state and local public health agencies are saying, you're confident in the safe and productive workplace you can provide.
Thanks, Sean. Also got a question regarding thoughts about employees who are likely or most definitely in a high-risk group but don't wish to be accommodated. Yeah. What's the obligation of the employer? What should HR to do?
Yeah, so this is a really delicate area that I think each organization has to be especially sensitive to. One, make sure you're not presuming that you think someone is in a high-risk category. And so I think you have to go back and verify either what assumptions you're going on. I'd be very, very careful about the age issue. especially because the EEOC has said that very clearly they're watching as to how more senior people are treated in the workplace to make sure that they're not being treated differently than other people. So the presumption that all people over a certain age should be working from home may not be the accurate one to make. And so I think you have to engage the individual. You have to go on information they're providing you, not assumptions that you're making about what you think causes someone to be in a high risk category. You can enter into the conversation, but just be aware of the ADA and the HIPAA limitations of how that information is used.
Thank you, Sean. We have a couple more questions, and when we break to allow you guys some time to chat with each other, I'll make sure our team talks with Sean about some responses there. In the meantime, I don't know if everyone wants to unmute and clap, but please join me in thanking Sean for his remarks today and for his time. It was most appreciated and very helpful to our audience.
Natalie, thank you so much.
Okay. I see the hands clapping. Well done, guys.